Hey everyone, it's Dr. Salcedo, your conscious gynecologist. I'm so glad you're here. And today I'm going to talk about something that I've actually struggled to talk about on this channel for a really long time. And I've sort of hinted at it for a little bit, but I really want us to actually create a video that talks about my thoughts on the effect of trauma and endometriosis. It's something that I've noticed for several years now in my practice when I discuss inflammatory factors that could potentially mediate hyperinsulinemia and inflammation. Many of my patients describe to me that they've had experiences with either some sort of adverse childhood experience or traumatic event in their life. Now, I've struggled to discuss this because I don't want to come out and say that endometriosis is caused by trauma, but there is so many associations, and actually after I've done a deep dive in the literature that actually supports this association, that I think it's really important to highlight in this channel. Now, what is trauma? Well, trauma is a certain event that happens in a person's life that activates the fight or flight response. And remember, when we were cavemen, the fight or flight response was there to keep us safe, to either fight the bear or run away from the bear if there was a bear chasing us. However, in modern day, there are influences that may trigger this traumatic response, this fight or flight response rather. And when you have this fight or flight response, there is an activation of adrenaline and catecholamines that tell our body to get ready to fight or run. But if we can't fight or run because we're being held down, because we're stuck in a car accident, because maybe we're too little to run away, the physiology of the trauma and response and the fight or flight response heavily relies on our body's ability to run, to discharge that adrenaline, to get away from whatever it is that is coming after us. But if we can't, then that adrenaline never gets discharged and can actually stay stuck in our body, stuck in our neurologic system, and cause a little bit of hyperreactivity. It can cause a hyperinsulinemic response. So when you have that traumatic experience, there's a flood of these adrenaline and catecholamine molecules, and that increases glucose. That increase in glucose is going to be available for your body so that your muscles can use it to fight or flight. But if you can't, and that feeling never gets discharged, then you chronically have elevated glucose response, chronically have activation of your immune system, chronically have elevations in hyperinsulinemia to try to capture all of that elevated glucose that's in your system. How does that relate to endometriosis? Well, we know that the traumatic response is highly associated with the gut-brain axis, right? And if we can take that and associate that together with the gut dysbiosis that might be happening with endometriosis, then we can see the connection of how endometriosis may be mediated by the traumatic response. And because of that, a lot of ladies with trauma end up having a lot more pain-related disorders like fibromyalgia. They're highly associated with chronic pain syndrome. And there is an association of trauma with endometriosis. And in fact, the Nurses' Health study that was done, a giant prospective cohort study that looked at women and their medical problems and all their different associations involving thousands and thousands of women, 50 to 60% of women who've had a significant trauma in their life were associated with having endometriosis. And that's huge. When I learned that fact, I actually started to screen for it more and more in my practice. And I would say that even within my practice, that number is much, much higher. So interestingly, what does trauma and how does that affect women with endometriosis exactly? Well, what we're seeing with some of the literature is that ladies who've had experience with trauma have a higher reactivity involved in their nervous system that increases pain and the experience of pain within those pain receptors. And so we know that when women who have an endometriosis flare, their pain is way worse than what someone who has just regular painful periods. And in fact, we know that women who've had surgeries for endometriosis, oftentimes when surgeons go in and take a look inside the pelvic cavity, they don't really see too many lesions, too many endometriosis areas to quote unquote justify the pain. However, we know that the nervous system of a woman who has endometriosis is way more reactive, and so the experience of pain may be more amplified than that of someone who actually has like a lesion or like a physical manifestation or physical example of pain in their body. Okay, maybe these women have like a tumor. Oh yeah, if you have a tumor, of course you might have pain, right? When surgeons do surgery on women with endometriosis, they don't always see a lesion that could quote unquote justify their pain. So how does trauma affect women with endometriosis, and how does trauma influence pain? Why do some women with endometriosis have severe pain even when the disease looks mild? Well, a new study in 2025 looked at trauma, psychology, and pain in women with endometriosis. And this cross-sectional study, looking at 120 women who filled out a survey regarding their experience with pain, depression, anxiety, and endometriosis, reported that they had higher levels of a history of trauma in their life. In fact, 50% of these women that were surveyed actually described having a history of trauma in the set, and they were all these women that had endometriosis. So among this cohort group of women who had endometriosis, 50% of them had an experience of trauma. So what do we learn from this study, and what do we learn from the information that I presented in this video? Well, we know that the experience of trauma is highly associated with the experience of endometriosis. And so we also know that women who are experiencing endometriosis, many of them report high levels of dissatisfaction with the standard of care that includes medications, hormones, and surgery. And so could it be that if we incorporate the understanding of these associations, we could develop a whole person treatment approach? The standard of care for treating trauma is trauma therapy, and trauma therapy utilizes the understanding of how the nervous system influences a person's ability to cope with trauma and stress. Now, there are all these incredible, interesting protocols that help treat the experience of trauma in someone, and one of them is called EMDR, eye movement desensitization and reprocessing. This protocol actually uses the muscles of your eye or tapping motions to actually use those muscles to discharge the trauma that a person may have experienced in the past. It's incredible. And so while there isn't any study that shows that the use of EMDR in the treatment of endometriosis influences pain, we do know that women who have experienced trauma in their life have a higher level of perception and amplification of pain in their body. And so taking that and connecting it to endometriosis related nerve pain, it could be that if we incorporate EMDR or trauma-based therapies into the treatment plan, we might positively influence a woman's experience of pain without the use of medications and surgery. So I hope you found this video helpful, and I hope you understand why it may be a little bit challenging to introduce this topic, because these are really difficult times in women's life, and to really connect them to something that is so intimate as for a woman like her endometriosis pain, it's a challenge. But I hope you found this video to be helpful. I hope that you found that it could maybe help someone that you know or love. So if you did, go ahead and like, share, and subscribe this video so that we can help women with endometriosis pain and we can help understand how the influence of inflammation, hyperinsulinemia, and maybe even trauma can impact their care. If you're interested in a consultation, check out consciousgynecology.com and I'll be able to help you. My personal mobile phone number is there, and as well as my email address and a way to make an appointment. I would love to help you through your specifics of your journey.